Hello everyone, my name is Sebastian David, and today I'm going to be going over hyperlipidemia for the Canadian Certification Examination in Family Medicine. These are the skills that are going to be tested. They're numbered and they'll be referred back to throughout the presentation, as you'll see. So the first skill that we're going to be looking at is screening appropriate patients for hyperlipidemia. So who do we screen? Well, we're going to be looking at both men and women aged 40 and above. This is a recent change as of 2016. And we're going to be looking at any of the following risk factors: diabetes, smoking, history of cardiovascular disease, looking at any signs that can give us an assessment of their lipid status. Skill number 2, how do we test or screen these patients? So for all of them, we have to do a physical exam as well as a history examination. We have to take a lipid panel, lipid profile, and this does not need to be done fasting as it was previously done. Another change as of 2016. We want to look at their glucose level and their glomerular filtration rate. In skill 2, we're going to be doing our risk estimation. We're going to be using the Framingham test as a cardiovascular disease risk calculator. We're going to be looking at men and women aged 40 and above, a change that has occurred as of 2016. We're going to not do this risk estimation if they already have a diagnosis of a cardiovascular disease. They're classified as high risk, as seen, and we don't use biomarkers as part of the risk assessment. In secondary testing, we'll be doing the coronary artery calcium measurement, CAC for short. CAC screening is appropriate for asymptomatic middle-aged individuals with an intermediate Framingham score, where you're unsure of what treatment that you should have. There also should be considered for low-risk middle-aged individuals with a family history of premature coronary heart disease. It is not recommended that you use CAC screening for high-risk individuals, patients on statin treatment already, and most asymptomatic low-risk adults. It should also be noted that using CAC scoring as a rationale for not considering other therapies is not recommended at all by the CFPC. In a patient with hyperlipidemia, looking at assessing skill 2, we have to look at all the risk factors listed earlier in skill 1, obesity, diabetes, smoker, etc. You'll see, and do the test covered in skill 2, and assess the various factors, with age being the biggest determinant. Some of the skills and risk factors mentioned earlier are here: family history of premature cardiovascular disease, obesity, etc. For treatment, skill number 4, ensure that patients diagnosed with hyperlipidemia receive appropriate lifestyle and dietary advice. Periodically reassess compliance with this advice, especially in patients at overall low or moderate cardiovascular risk. How do we do that? If they're smokers, tell them obviously to try and stop and slow them down. Diet, changing what they're eating, so looking to reduce the fats that they're consuming, refined sugar, reducing their sodium intake, advocating for lots of fruit and vegetables. An example of a diet that you could recommend is the Mediterranean diet. There's also the DASH diet. If you're familiar with that, that can also be recommended. Weight reduction and maintenance if the person is obese or slightly overweight. This is one of the risk factors that we were looking for in skill 1 and 2. And these are some example exercise guidelines for the patients given their age. Risk appropriate treatment. So this kind of ties everything together, and it lightly jumps into skill 5, which is in treating hyperlipidemic patients establish target lipid levels based on overall cardiovascular risk. So we need to look at the different risk categories that they're in. So if they're low risk, there's actually no pharmacotherapy involved, and we just look at managing their diet and everything that we mentioned in the slide previous. If they have an intermediate risk, we will look at their lipid levels and make an assessment as such. I've listed the recommended levels here. Should note that statins are the first line of therapy, but there may be additional pharmacotherapy that is needed. Continuing on, for skill 6, we have some recommendations by the CFPC on how to communicate these side effects. So key points include telling them that the benefits outweigh the potential risks that could happen. It is very, very uncommon for there to be any sort of major detrimental side effects, about 5% or less in most of the medications given. And that wraps up our quick overview of what is required of you to learn for hyperlipidemia, one of the 99 topics.